Welcome to Healthcare Rounds. I'm your host, John Marchica, CEO of Darwin Research Group. My guest today is Dr. Jonathan Stallkamp, Senior Vice President and Chief Medical Officer at Mainline Health. And in his role, Dr. Stallkamp sits at the intersection of clinical practice, physician leadership, system strategy, and culture. And so today's conversation is about leadership and specifically what it means to lead physicians inside a complex health system. So without further ado, Dr. Stallkamp, welcome to Healthcare Rounds.
Well, John, thank you for having me. Really excited to be here today.
So I guess we'll start off. I usually like to ask general background, but I'm going to frame this question in a little bit different way because when I think about physicians going into leadership roles in health systems, a lot of can talk about how they got there, but I'm curious as to why you're staying after all of these years in different roles in different systems. So when did it stop feeling like an extra responsibility for you and really start feeling like your work as a leader within the system?
I think for me, that started really early. I started out in the world of hospital medicine and started out leading there. And at a very early point in my career, I realized I could do more for my fellow physicians and for my patients in the leadership role. And I've really always enjoyed it. Some people think, oh, it's something else to do. But when you really look at it on a macro level, you can see the difference that you're making. And that gets you excited. It gets you excited every day. And then with my career, I've advanced and kind of moved up through the career up to becoming a CMO. And I've always had a kind of new challenges that come along every day. And that's what keeps me going.
So you didn't experience any, sort of identity shift going from, a clinician or hospitalist to being in more of this kind of CMO role? I know it's taken you a while to get there, but any sense of identity shift around that?
I think a little bit as I moved up a little bit higher, more to the VP level than to the system VP, the senior VP level. I think that's where I started having that shift. And I still do practice clinically. So I'm always out there actually still identifying with patients. I think as I hit my CMO role, that amount kind of pulled back a little bit. And that's where I kind of felt a little more like the suit than the white coated clinician all the time. But I still get back. I still want to see those patients every day. I still want to have that clinical street credit to actually be able to work at the level that I do.
And I'm sure that kind of street credit is important when you're leading these physicians. You can say, "Hey, I'm still in it." Right? It's not like you're in the ivory tower of corporate and you're not identifying with day-to-day patient issues in the hospital.
Yeah, I think that's what you really have to, especially as a senior leader, you still have to connect back down to really what you went into healthcare for, and that's to care for people. And really understanding it's that person in the bed for me, or the patient in the office is the one who I can then go see and realize that all that work I'm doing is not just for this one patient that maybe that's in front of me, but for the whole system and the communities as well.
Sure. Well, one of the reasons why I was actually really excited about this conversation is this topic of physician leadership has been around for a long time. And health systems, I've noticed in particular, have gone from having like MBA types running and to kind of the shift towards more of a physician leadership model. And of course, at a CMO role, it's very, very rare that you would ever see somebody other than a physician in that role. But my question is, in what I know about doctors, and I interview and talk to a lot of doctors, they seem to be, very autonomous.
We are
obviously highly trained, but also kind of skeptical of authority. And maybe this kind of goes back to being in the trenches and being able to talk to them. But I guess what I wanted to ask you to address is, what do non-clinical or non-physician executives, do they not understand about leading doctors?
I think you touched on a couple pieces. We are very individualistic. We do always want to question, I think, a little more than a lot of other staff members do. We're very analytical. It's just how we were trained. We're always there to look at all the different options and to think about everything differently a diagnosis could be. And we kind of take that kind of understanding and apply that to our general business moving forward. We tend to be independent. You have to show us the data. You have to prove it to us. But once you do, we'll follow. But you really have to continue to prove it and to prove it regularly that things are still progressing in the right direction.
So I'm going to use a term that I'm going to apologize in advance because I feel like it's so overused, but it's physician engagement. And when I think about, on healthcare rounds, we've talked a lot about burnout over the years, and certainly post-COVID, exacerbations of burnout. But, when you think about physician engagement, I'm wondering what causes physicians to kind of disengage beyond the burnout. What causes them to be skeptical or not want to be part of, the direction that you're headed? And then how do you bring them back? How do you build that trust once maybe you've never experienced this at Mainline, maybe in past roles or you've seen this, but what is maybe a different way to ask the question is, what are the keys to keeping physicians engaged and part of the process?
I think it's making sure you understand what's going on in their world, really what the frontline clinicians are feeling, understanding what's really bothering them. And it could be things that are systemic in nature, healthcare reform, or insurance is not paying them. Or it could get down to something as simple as, I don't have a parking spot to get to. The EMR doesn't work right for me. Those little details, while they sound small, not as big as something like healthcare reform or payment reform or anything like that, really make a big deal to doctors. And when you can make some of those things get better, I think that's where your doctors get more engaged and understand that you're really out there to care for them.
So let's assume that we have other chief medical officers and other leaders that are listening. If we were to talk about the nuts and bolts of how you find out that information, how you communicate that, there's that two-way conversation? Because I'll be honest with you, my little company, we have 30 employees. Mm-hmm. And sometimes it's hard for me to be able to communicate and listen, have that two-way conversation going, despite all the technology, despite the fact that most of us are under one roof. So what are the mechanisms that you use, and how do you listen for that and know that how do they know that you're responding?
You have a couple ways. You have the leadership of any healthcare system. You have an independent medical staff at all hospitals, and you have to listen to the leaders there and hear what they're saying, but also listening to the frontline folks. So as a CMO, we have 4 acute care hospitals in our health system. I can't be on every single one of those campuses every day and talking to every single one of those frontline doctors on a regular basis. But I do have other leaders that I trust. I have vice presidents at every single one of those campuses who are out there seeing patients on the floor, spending a portion of their days seeing patients and the other portion doing administrative, who are out there just walking the hallways, rounding, talking to people, hearing what's going on, and just developing those long-term relationships with with all the kind of the key leaders that are on site, but also those non-leaders that are on site and those kind of casual leaders. Just really, what's going on? What can I do to make your life better? What's really bothering you? And those are key things you have to do. If you don't reach out, if you don't ask that question, you're not going to know, you're not going to be able to engage your docs.
Sure. Well, when I'm thinking about, I'm going to switch here a little bit to performance. When I think about performance, and this kind of goes back to my ACO days and learning about that back in the early 2000s as those concepts were coming on board. This is following managed care, but really this focus on performance, physician performance. And we talk about, using data sets or peer influence or scorecards. So I'm just curious, in your experience, what are the best tools that you have to, let's say, maybe change longstanding patterns that you want to kind of have a new way of doing things, and then measuring that performance? What do you think works best with your fellow physicians?
They do look for scorecards. I think scorecards work well. I mean, we have dashboards and how you set them up, but you need to be able to give the doctors their regular data. Then you also have to explain the data to them, what it is and what it's really saying, and have them buy into the data first before you start holding them as accountable to it. Because if they don't understand it, they don't understand where it's coming from, and they don't trust it, they're not going to follow those changes that it would suggest. So we spend a lot of time talking about it, going through the data. Our doctors, especially our employed physicians, all do get scorecards on a regular basis. I've been doing that honestly for all my career, and I found that's been honestly one of the best things to do, is to show how you're doing, and then show how others are doing too as well. Where do you fall? Because one thing about doctors, we are incredibly competitive people. We didn't make it and get through medical school and get into residencies without being a little competitive. And, when you get a scorecard and you see something that doesn't have all A's on it, because you always grew up and you had to get all A's, otherwise we wouldn't get into med school. That's where docs, I think, kind of wonder. And then, of course, they'll first challenge the data. But if they understand the data, they understand where others are performing well. And then a lot of times I will partner them with individuals who are doing well. So say, hey, Dr. Jones is doing this really well. Why don't you talk to Dr. Jones? See what he does differently or she does differently in her career, and have those conversations with them, and maybe tweak how you do some things. And that's where I think individual mentoring, it's hard to do that as the CMO, but that's where I have my leaders that I have to trust and I have to work with, and work to make sure that they share that information and work with people to improve. Because really that's what we want. I don't want to throw people off the staff. I don't want to fire doctors. I want to encourage doctors. I want more doctors to want to come to work at Mainline Health, because it's a great place to be, because we're going to work with you and we're going to develop you.
What role, if any, do nurses have in that kind of ongoing education process? And I get it, coming from leadership and even hospital leadership, but do you have any of that, I don't know, kind of coaching and mentoring coming from the frontline nursing staff?
We always want to know what our nurses are thinking about us, right? I mean, they're a key partner, and I'm a hospitalist initially by training. I've always worked with my nursing staff. They are key to what I do. I can't do what I do without them. Same, I would say, for a surgeon. You can't operate in the OR without those nurses helping you. So understanding what they think about you, how well that you're performing with them, is incredibly important. So we will do and send out information to key nurse leaders to see how doctors are doing and how they're performing. We'll take that feedback, and it's one piece of feedback, but it's an important one.
Sure. So switch gears one more time. I'm wondering about how you identify, or maybe you'll say this isn't in your responsibilities, but I'm guessing it probably is, how you identify the future leaders of the organization, future physician leaders, how you find them, and once you do, is there a mentoring process to bring them along? Or am I making a lot of assumptions here about how things are going at Mainline?
No, you definitely are right on that. We do a lot to try to develop, really have actually built some new programs in place with one of my vice presidents recently, to help to develop our younger physicians. And we have what's called a Lead Well program, which is really a physician leadership development program. Dr. Claiborne Childs, who's one of our VPs, helped to really develop this with our HR team here to really pick out early practice physicians, or physicians who are about to change roles, to help to develop them to really understand what it is to be a physician leader. And so to find those docs that we want in that cohort, in those classes, we work with our chairs, our VPs at our other campuses, our nurse leaders, all of our leaders, to kind of help to identify who's that up and coming person that you see that really could be a future leader within the organization. And we'll help put them through something like this, through this Lead Well program, this development program. It's a year-long program. We build it as a cohort with all different specialties from all of our different campuses, because we didn't want to do it just put all our OB doctors together in one group, or put all of our internists in another. There's a lot of important important information that you learn on how an OB deals with the situation differently than, say, a pathologist, than an ER doctor. And having that conversation amongst how people have dealt with different situations really helps that course really develop and helps those leaders develop. And all of them have really enjoyed it afterwards, and then have looked to either move on to additional leadership responsibilities and done well with that, or to find additional leadership development outside of the organization as well.
Yeah, it's one of those things that certainly they're not teaching in medical school. I remember there was a popular book. I'm going to say maybe 20 years ago, maybe longer. That was what they don't teach you at Harvard Business School. So even going to business school, the kind of the softer side of things, or maybe that you wouldn't learn in an accounting class. So I'm just curious, from your sense, what's the biggest developmental gap? Because obviously these are all smart people, right? And they've exhibited certain leadership traits that would want to bring them into this program. But where do you find the biggest gaps that you need to work on when they're going through a program like that?
I think one thing I do see for some of our docs is that they're amazing clinically. They are the best that you could care for a patient. They're the best surgeon. Doesn't always make them the best leader, though. And there's a leadership intelligence. There's an emotional intelligence that at times can be missing a little bit. And I think that's a little bit of an issue that we have seen in the past. And understanding that emotional intelligence that you need to have to work with people, to lead people, is one that can be there among some of our stronger clinicians. And so that's a piece that we want to work on. We want to develop in people, and that they can really understand where other people are coming from, whether it's another specialty, whether it's someone else in their group, or another field such as nursing.
That makes so much sense, because if you think about it, let's say, I don't know, in cardiology, which is a huge specialty, right? But you have somebody who is top of the game, maybe a top-notch researcher, maybe is known to be a huge opinion leader in the area. Well, that doesn't necessarily mean that people are going to want to follow what they have to say, or that they have, like you said, the emotional intelligence skills to have others follow them. I think about it in more practical business terms. The best salespeople don't necessarily make great sales leaders, right?
That's absolutely true.
So it's the same kind of thing. The best clinicians, or the most knowledgeable in a given specific area, might not be the natural leader, although maybe they feel that they're entitled to that, or they should be a section head or a leader for just based on their knowledge. So I could see how that could be a struggle.
Yeah, we've seen that too, I think, for a lot of docs who said, I want to be a physician leader. And so they don't necessarily go out and talk to a physician leader to say, how did you get there? How did you want to get to that next level? What did you do? A lot of docs say, well, how did I get to med school? I went to school. So I'm going to be a leader. I'm going to go to school. So I'm going to go get my MBA. And that's going to make me a physician leader. And I've had doctors come up to me and say, okay, I'm ready to be a VP now. I'm like, why? Oh, because I just completed my MBA. I did great. Look at what my grade is, my MBA class. I'm like, but you haven't done any of the work. You haven't actually led a person. You haven't actually had anybody underneath. You haven't developed yourself yet. Like, you've got to do that piece first. I'm like, really? Why? We got a little work to do here, but right. It's all good.
Well, I'm thinking, there's also, and we talked about this in a recent episode, there's also the need for local leadership, as you described it in the hospital, and having these VPs, but being able to how do you translate that local leadership into something that is more system-wide? So I'm not exactly sure if I have a question around that. It's just maybe around more how do you manage that transition, right? From being more in the trenches leadership, I guess, to more strategic. I don't know how else to put it.
Well, I think you're also talking about culture. How do you set your organizational culture at the system level? And how do you bring that down? And how do you get the information that starts at a lower level, say in the trenches, and then bring that back up? And so really for me, my role is to work with my next level down, my VPs, my chairs, to make sure we're all in the same culture, that we're all rowing in the same direction, and to make sure then that translates down. And so I'll work with my VPs, I'll work with my chairs to make sure that that's going down to their divisions, to their sections, and that those individuals are feeling the same thing. And it's the same way that, I want to hear from the very frontline docs what's going on.
So, Dr. Stallkamp, this all sounds almost idyllic, right?
It isn't always, trust me. I wish it was, wouldn't it? That'd be great.
Well, that comes to my next question, which is, again, thinking of the typical strong-willed, independent, critical thinking, highly competitive, all of these attributes we've been talking about. How do you manage dissent? Or maybe that's a strong word, but you're getting the sense that you're wanting to take the organization one way and you're getting a lot of pushback. That could be around like a quality metric issue, or it could be something more systemic. How do you manage through that kind of conflict? And if you're willing to share, it doesn't even have to be at mainline, maybe something that you've experienced in managing conflict in your history as a leader in different organizations. How do you do that?
So, John, I think it's just, it's not always easy. It's not always easy. You're going to always have these situations where someone's just not going to agree and they're not going to get it. But I think it's taking the time to listen. The worst thing to do as a leader, and I know you've seen this in other areas, where they just try to ram something through, and that's not going to work. It's not going to work unless it's an absolute emergency and then something has to happen. You need to listen. You need to hear where they're coming from and understand what their issues are. Now, you're not always going to agree. And there's certain things that, financially I can't do as a health system to help you. And there's different issues that are going on, in the healthcare landscape unrelated to me that it's being an issue for you and your practice. I can't fix that. But I need to work, one, to listen to what your concerns are. Listen to say you don't like this measure and why not. We can talk about it, or it's not measured correctly. Let's talk about how it's measured. It's just having that constant conversation and being able to work with them. But in the end, if it does need to go a certain direction, at some point you do have to hold the line and not make a change. And hopefully they come along. And, I've had doctors where they have, and, we've had battles back and forth and, oh, I can't believe this guy or that. And then in the end, you hopefully come to the right middle ground, that conclusion on where you're going to go, and we'll move the group forward. But, really it's what you're focused on is that patient in the bed. It's providing high quality, safe, effective patient care. That's where everybody should be grounded on. And that's what we try to push forward.
You mentioned culture. This is another one of those things. When I look behind me, at least quite a few of those books are dealing with leadership and culture and all of that. And I got to be honest, I struggle with it. And again, in a small organization, how to consistently reinforce those elements of culture. And, obviously to some degree, it comes from the people themselves, but the tone and all of that, it's got to come from you as the CMO, and you're reflecting the culture of the overall organization. So I don't know, how do you do that? Or what are some things to be thinking about around culture? You talked about, making sure that you're having buy-in or that kind of agreement and pulling them along, but specifically, how do you continue to communicate and reinforce the culture that you want in your organization?
Well, I think it's understanding. We don't just set it. I don't set it myself, right? It's set really initially by our whole senior team and our board. Will set the culture of the organization, the direction of the organization. Really, the CEO especially drives that. It's my job to help to translate that down and to really focus it. And look at Mainline. One of our really, again, our focuses have been on the patient. It's been on high quality, safe, effective patient care. That's what we want to do, providing that human care to the patient, that touch to the patient. That's what we want. And that's how I will speak to my doctors. That's how we'll work with our nurses. And when somebody's not quite following that direction, that's where we have to have the conversations and say, hey, this isn't what we do here at Mainline. You don't throw instruments across the table. It doesn't happen here. It absolutely doesn't. occasionally had a new doctor who does something that isn't used to our culture. And we sit them down, have that conversation, whether it's the chair of the surgery, it's the VP there, we don't have it. If I need to be that person who comes down and has that conversation, we'll have that conversation. But that's not our culture. And we have to hold firm to our culture.
Sure. Last question is really, really about the future of physician leadership within organizations like yours. And I want to come back to one specific area, which is retention. We at Darwin, we study health systems and healthcare markets. I know you're in a highly competitive market. And so when you think to the future, and we've been talking about bringing these new leadership aboard, but how do you retain physicians and how do you distinguish yourself as an organization, again, thinking to the future when you're in this highly competitive market?
Well, we try to bring in and develop our leaders. We try to we develop them in-house, and we'll look externally too as well. We want to give them opportunities and opportunities for growth and opportunities in which they can show change. We don't have, I'm not in the largest healthcare organization or healthcare system in the country. I'm in one that's a decent size, but it's one that actually you can show at a small level, a doc can start to have real difference in. And as a leader, they can develop and they can show they can do a little difference here, a little difference here. And that gets them excited in leadership. It gets them excited to do that next level and to stay with us and to kind of work with us further. That I say, hey, I'm doing a great job as chief of GI. Maybe I could become the chair. Maybe I could switch and decide I want to do more overall, like a vice president of medical affairs where they're covering all their specialties. That's something that showing that there's that growth opportunity for them within the system is really key. Now, at some point, there won't be anywhere else that they could go, because if you want to get to the CMO level and I'm still there, well, maybe it's not. But, I think from my standpoint, I want to develop the greatest leader ever. And if I have a couple of people who work under me as vice presidents of medical affairs, and please nobody steal any of my VPMAs. But if they want to be, if they end up becoming a CMO at another health system and they do really well, I'm really proud of them because that's something that I helped to develop and our mainline health culture helped to develop and send out into the world. But when people see that there's an ability to keep advancing, I think they want to stay. And that's been a really good thing for us. And it's really helped us with our retention of our leaders. I've had physician leaders working with me directly, ones that I've developed now for 15 years, which has been great. But there are other new ones that I'm bringing in. I'm bringing in a new doc who starts next month from a competing health system. I'm excited to work with him to develop him in his leadership skills to work across our organization.
Well, before I ask my last question, I just got to say that I'm having this conversation with you, but so much of what you're talking about, I'm thinking about for my own organization. As I said, when we talked about culture, I'm hoping that the folks who are listening that can understand that a lot of the things you're talking about, a lot of these principles, really, it's not just with physician leadership. These are just good leadership principles and good management principles and thinking about, and again, it's not always perfect, right?
No.
You can do your best and you can do your best to set the stage. But I think there's a little bit in this conversation for everybody to be thinking about leadership in general. So with that, before we get into our lightning round, I want to ask, which sometimes I forget to do this, but I try anytime we have a physician leader on healthcare rounds, I ask, if you were giving advice today to somebody who's finishing up their residency and they're coming into this crazy world of healthcare delivery and all the changes in technology and all the things that we're experiencing, what advice, and maybe you do this already, but what advice would you give a budding physician coming out of their residency?
I'd say a couple things. Number one is you went into healthcare to really care for people. That's why you're doing this. You want to be with those patients. You want to be with patients. You want to make their lives better. That's why you're there. So when you're thinking and you're stuck on something and you're maybe not as happy as you want to be in your life, you just think about that patient that you're really working forward with. if you want to go into leadership and you want to move forward in your career, take advantage of some opportunities that are given to you. There's not always a clear pathway to leadership development. I didn't think I was going to be a CMO when I first started. Is that the way I want to go? I don't know. I know I want to be a hospitalist. I want to care for patients. I'm going to, be there in the trenches all the time. Certain opportunities will go there. Take advantage of them. Enjoy that opportunity. Work. Maybe move laterally from time to time in your career, but that will get you a lot more experiences that really develops you more as a leader and as a person. And take advantage of those. That's
excellent advice. All right, here we go. Lightning round. So just quick responses. Right. Best leadership advice that anybody has ever given you?
Best leadership advice that anyone has ever given to me. Just keep working hard. To keep your head down and keep working.
A book, a thinker, or experience that unexpectedly shaped your leadership?
For me, it was taking an opportunity to work with the Indian Health Service in Alaska. I worked at a very small 20-bed hospital in Bethel, Alaska. And they gave me the opportunity to say, we're all going to go on vacation for Thanksgiving. Do you want to be the administrator on call of the hospital? And this was literally 6 months since I graduated residency.
Wow.
So that was an unexpected leadership experience to run a small hospital in rural Alaska that was well worth it.
Wow. All right, last one. Are you watching The Pit?
I have watched The Pit. And I'm from Pittsburgh originally, so it brings back a lot of memories.
So is it fairly accurate or is it wildly dramatized?
I'd say it's actually very accurate. It's just dramatized in the time scale. All those events and things that absolutely happen regularly in healthcare. And I think many of your listeners have absolutely seen those things happen. Have they happened all in 24 hours? No, not really. But all those situations have happened to me. I've seen many, many strange things, just not all in 24 hours.
Yeah, every time when my wife's a nurse, and when we watch it, what always comes to mind is, why hasn't anybody fixed this emergency room problem? It's like, it always looks like that, right? And on TV. But then when you go to the ED, luckily I haven't had to in a number of years, but it kind of feels like that. So, and you don't have to answer that question. I know that's if we had that figured out, I don't know, maybe that's the $1 million question. But anyway, Dr. Stallkamp, thank you so much. I really appreciate your taking the time to dive into leadership topics. I'm fascinated by it, and wish you the best of luck and hope that you stay in touch. Maybe you can come back sometime.
Yeah, John, again, thank you for the opportunity. Really appreciate it. And it was great speaking with you today.
Excellent. All right. Well, that was Dr. Jonathan Stallkamp, Senior Vice President and Chief Medical Officer at Mainline Health. If you enjoyed this episode, please subscribe to Healthcare Rounds wherever you get your podcasts, and feel free to share it with a colleague who's thinking deeply about leadership in healthcare. As always, thanks for listening. I'm John Marchica, and we will see you next round.